Welcome everybody to our online program for the alumni of the Sunshine Coast Health Center, and we've been talking about what we can learn from the research on why therapy works or how therapy helps people. Probably the most consistent finding we've discovered when we ask clients, like, what was it about therapy that really helped you out? They almost always tell us that one of the key pieces, if not the key piece, is forming this relationship with the therapist, or if they're in group therapy, with other members of the group. And it's really remarkable just how consistently we hear this. People listing this, there were 5 things that helped me, but number 1 was this relationship that I developed, with other people in the group or with the therapist. This trusting us, this feeling where they're free to open up without fear of judgment. And some have suggested maybe this is the strength of support networks. If you go to, say, Smart Recovery, or if you go to AA, that you have this group of supportive people there that can help you, and that you gain an authentic connection with them and a deep emotional connection with these people. So this is actually kind of interesting. From a psychological point of view, it makes perfect sense, because all of us are what the psychologists call relational beings. We're hardwired to be around other people. And we've mentioned before in the online program about a lot of psychologists, for example, Roy Baumeister, who says the reason that human children take so long to develop is they have to learn how to become social animals. They have to learn how to exist in this social world. And as you all know, one of the worst things about the addiction is that it isolates people, and most clients coming into Sunshine Coast, for example, will tell us they feel alone, or they feel isolated, or they feel alienated. And certainly the pattern of drug use consistently is to push people away until you're ending up either using alone or with other people who also use drugs. But this idea of being isolated, being all alone, being separate from other people, maybe it's that's being addressed by forming this relationship. But who knows? I think we need a lot more research on that particular component. But it's interesting that no matter what the therapy, no matter what the problem, this idea of forming a connection with other human beings seems to be absolutely fundamental to how therapy helps people change. Anyway, then you can ask yourself that too. Do you feel connected with other people now that you're in recovery? And certainly the alumni who are thriving, that's just almost inevitable. They will tell us that they're feeling a sense of connection with other people, and they've got a support group, and they're getting closer with their families, and on and on and on. Okay. Anyway, that's it for this week on the online program, and we'll be back next week with another part of this topic.